Good afternoon. Thank you for the opportunity really to talk to you about the work that we've done to try to reduce immunization waivers and ultimately get more kids vaccinated. The more kids that we have vaccinated, the better protected our population is, and that's really what our primary goal is. So let's start out. I guess I got the talk a little history about how immunizations work in Michigan, because it does vary from one state to another. Schools in Michigan are required to report all kindergartners, all 7th grade, and anybody else who transfers from one school district to another. They report twice a year. They report November 1 and February 1 of each year. And then children who don't have a complete immunization record or don't have a certified signed waiver should not be allowed in school on day 1. That's our way to assure that we can show compliance, not necessarily completeness, but compliance to the laws and the immunizations that are required. So these are the vaccines that are required within Michigan. And again, these do vary a little bit based on one state to another. We require the DTaP vaccine, diphtheria, tetanus, pertussis vaccine. We require polio. We require measles, mumps, and rubella, the MMR vaccine. We require hepatitis B. And we require varicella for kids that are coming into kindergarten and transferring. I'm sorry? For older kids, meningococcal vaccine is required. That would be for the adolescents going into 7th grade or older. They're required to have the meningococcal vaccine. Every state is different as far as what's required for schools, but also the waiver policy. This is a map of the United States showing the different states and what waivers are required across the country in different states. And if you look at this closely, the ones in green are the ones that require or allow for all 3 types of exemptions. And the 3 types of exemptions that we have are medical, and every state in the country allows for a medical contraindication. That would be for a student that's entering a program that can't receive a vaccine due to medical conditions. They might have a severe allergic reaction to a vaccine, a known allergic reaction. That's very rare, but it does happen. But the other situation could be that they're immunosuppressed or something like that on chemotherapy, and they wouldn't be able to receive a vaccine, so they can't be protected. So those are medical reasons that they can't receive vaccines. And if you look at the white states, those are the 3 states that only allow for a medical exemption. There are 3 that allow that. There are 3 states that will allow for a philosophical and a medical. Or I'm sorry, a religious or medical. Those are the brown ones, Minnesota and Louisiana. And then if you look at the states that are in green like us, those are the states, there are 16 of them that will allow for all 3 types of exemptions. So really we have the most lenient ability really to be able to get a waiver as far as the 3 types that are allowed. In 2013, this is when it sort of peaked. We had the 4th highest waiver rate in the country, which was very concerning to the state. This is just for kindergartners. That's the only way that we can sort of routinely look at all kids, because all states to look at kindergartners. So we knew for kindergartners we had the 4th highest waiver rate, which was very concerning because that meant we had a lot of susceptible and at-risk kids across the country, or within the state. In 2014, we had worked with local health departments. They put some things in place to try to reduce the number of waivers. We moved up to 6. So still we had very high waiver rates at that point. And if you look at that in 2014, we had 20,000 waivers, so 20,000 kids that were in school with a waiver. The prior year, almost 27,000 kids. So a lot of kids that were unprotected. Many schools had waiver rates that were 20% or higher, which was a big concern to us. When we have pockets of high numbers of kids that are not vaccinated, that poses a risk to the entire population. So we decided we needed to do something to try to impact this so that we didn't experience outbreaks of vaccine preventable diseases. So on December 11th, we did pass, of 2014, we passed some administrative rules. And what those administrative rules did is a couple things. They changed that waiver requirement. In changing that waiver requirement, it required a parent that was seeking a non-medical exemption, so an exemption for religious or philosophical reasons, to go to the health department and receive education on the value of vaccines, on the risk of not receiving the vaccines and the benefit to receiving vaccines, not only to the individual, but to the community. And truly, I want to emphasize, this is an education. This is more sold as a discussion, really, with the parent. The second thing is that it did require the use of our waiver form. In the past, almost any form could be used, and this required our waiver form that really, so that they were aware of the risks and that we could standardize that form that was being used at a local health department so that we would have one form to certify. I will say prior to this, it was quite an issue because we had counties operating in different ways. And so by passing these administrative rules actually made a consistent, uniform way of doing this waiver process and reporting. So in some respects, it made it easier. It did also provide some additional authority in that rule. Even though a health officer of a local health department has the authority to exclude an individual that is susceptible during an outbreak, this just added some additional authority to that. So this is the wording that was put into the rules. It just says each non-medical exemption filed with a child's school or group program of a child entering a program after December 31st, 2014 shall be certified by the local health department that the individual receive education on the risks of not receiving the vaccines being waived and the benefits of vaccination to the individual and the community. And then it does go on to state that all waivers must be submitted using the waiver form prescribed by the department. Prior to us implementing this waiver policy, we had 10 counties that had already implemented it. And when I say 10, that's sort of prior to 2014 or 2013. In 2014, we did see a reduction in our waiver rates because some health departments moved forward and started requiring parents to receive an education before the rules were in place. That was their effort to try to reduce these waivers, so the health departments were taking it upon themselves to do this. When we look at the rates of the 10 that had implemented it, their rate was 3.3% was the waiver rate. The rest of the state was 6.3%. So we had a proof of concept. We knew if we could implement this on a statewide basis, we would see a reduction in waivers. We would see more kids vaccinated, which is what we were really after. I do want to make sure that it's clear that this waiver policy took away no ability of a parent to be able to sign a waiver. Everybody who wanted a waiver could still get it. All they needed to do, though, is go to the health department to make sure that they were informed on the risks of not vaccinating. And we truly talked to the health departments about this as a conversation. What are your concerns today? And let's talk about those concerns. So we put together, to roll this out, we had to do it very quickly. It passed in December of the prior month and then January. So we put together a lot of materials that went out to schools and childcare centers. We put out materials to healthcare providers so that they were aware of this change. We put together parent materials that could be handed out to the parents at the schools so that they were aware of what these changes were and what they needed to do. And then we put together documents on what we were hearing as the biggest concerns that parents had about vaccines. So we put a lot of documents together. These are some of the categories that we put together and gave them to the local health departments they could use as talking points as the parent came in for this educational session. So and this is sort of an example of one of the forms. And in every single form we put the concern that parents were concerned about, a general response that the local health department could use, the risk of the disease, the benefit of vaccines, and then any other additional resources they could hand out to the parent if they wanted to do additional research on it. So here's the results. In 2014, we had, if we look at this area right here, this is prior to the waiver education being implemented. And you can see for kindergartner, our waiver rate was 5.3%. So think about that. Only 95% of our kids had received all vaccines. That's a concern. We had pockets where kids weren't vaccinated. In particular, we saw certain parts of the state where the kids congregated, and so it was a big concern. 7th grade, 4.8%. New entrants, 4.5%. So overall in the state, it was 4.8%. And then childcare, it was 3.3%. After implementing it 1 year in 2015, we saw a 35% decline in our waiver rate. We saw a lot more kids that were receiving vaccines. And remember, we didn't take away that ability of a parent to sign a waiver. In 2016, then, we did see a mild increase. We saw a 0.1% increase, but still, over that period, we saw about 18,000 more kids that had completed the immunization series. So we saw great success in this, having more kids vaccinated. Not only is it kids that were completed, but some kids had vaccines that didn't complete the series of all, but at least they went in for 1 or 2 additional vaccines, and the more vaccines we can get, the more kids that are protected. This is sort of a chart by county of the waiver rates. The darker the color, the higher the rate. And if you look at where our problem areas are even now, the thumb area has higher waiver rates, and it's concerning to us. Northern lower Michigan there in the northwest side, a little bit in the UP. And actually we have one county that has rates still as high as 13.5%. Very large concern to the department. We also post the data on our website so that everybody has access to that, so that parents can be empowered really to look at the rates of the schools that their kids are entering and know if there's a risk of vaccine-preventable diseases. If you think about it, there are many children that are in schools that have conditions they can't receive vaccines, and they want to assure that their child is protected in that environment. And then lastly, I just want to touch on some national data. CDC just published the kindergarten waiver data for last year, and we were curious where we would fall out. So currently Michigan is 11th, still has the 11th highest waiver rate in the country, but it's much better than it was. 6 states saw a decrease in their waiver rates. Across all 50 states, we only saw 6 states with a decrease, 5 states that stayed the same, and all the other states had increases in waiver rates. That's of great concern to us nationally. I get on calls with other program managers that what we're seeing is more vaccine hesitancy, more vaccine resistant parents, and that's a concern to all of us that we could have problems with vaccine preventable diseases. Thank you.